Hi, I'm Katie Crane, and this is the Pilates Lounge. Hi everyone, my name's Katie Crane. I am the Pilates professional. Welcome to another episode of the Pilates Lounge podcast. I'm bringing you a fascinating guest today, or I should say a fascinating topic today, with an amazing guest. Zoe Anderson is a physiotherapist in Australia, but Zoe specifically has a passion and works with neurological conditions. Now, Zoe has an undergraduate degree from LaTrobe University, and she graduated in 2010. After undertaking a wide variety of neurological physiotherapy professional development, she completed her Basic Bobath training in 2014 and obtained a graduate certificate in Neurological Rehabilitation from the Australian Catholic University in 2022. After graduating in 2010, the first course Zoe completed was the Pilates Matwork Level 1, and ever since she has used Pilates in a variety of clinical settings to community with a large range of neurological clients. Zoe likes to combine her Basic Bobath training and knowledge of postural control, selective movement acquisition, and sensory motor integration into her Pilates. So I know that this conversation is going to be really interesting to a lot of you out there. And hopefully it's going to give some of you an insight into working with neurological conditions. Zoe's commitment to education and ongoing learning is evident in her role as chair of the APA, that's the Australian Physiotherapy Association, in Victoria Neurological Special Interest Group. One of the things she loves most about neurophysio is that there is always more to know, and she strives to never stop learning or sharing her knowledge. She's a strong advocate for having a diverse range of skills in her clinical toolkit, but does have a soft spot for Neuro Pilates. Welcome to the show, Zoe. Thanks so much for joining me. Zoe's in Geelong, so she's in rural, not so rural anymore, but rural Australia. And it's one of the reasons I actually reached out to you, Zoe. I live rural, and I feel like as a rural practitioner, quite often we do not have access to these really important conversations. So I love that you are living outside of a big city and that you're so much involved in such a special part of our population. I really am grateful for you to join me today. I'm going to give the show over to you, Zoe, so I'd love for you to first explain to our listeners what Bobath is, because most of our listeners are movement educators and Pilates instructors. So maybe if you could just give us a little bit of a background of that and tell us a little bit about yourself.
No worries. I think you've done a really great job of introducing me. There's not a whole lot more I need to say to that. I'm, as you said, both a neurophysio but also a Pilates lover, and I really enjoy combining those two things. Doing the math, this is my 14th year of working, and it was only a year or two of trying all areas of physio before I quickly realised that neurophysio is by far the best, and that's where I have since dedicated my career. First up mostly in the hospital setting, but the last 5 or 6 years working in community neuro, commonly with people who have long-term neurological diagnoses. And it's here that I've really had the opportunity to merge my personal love of Pilates with my career that I also love being neurophysio. So I am so privileged to say that I do absolutely love what I do and what I guess is called work, but doesn't even feel like that each day. So much so that I teamed up with my business partner in crime, Rosie, about 4.5 years ago now to co-found our business, Neuro Physio Geelong. It's really interesting to hear what you said about calling Geelong regional, but stemming from what you were saying about where you live, I grew up on a farm in Western Victoria, and then after going to uni, got the opportunity to work in some really amazing metropolitan health networks. But as incredible as it was, it left me asking, if something neurological happened to someone in my family, back on the farm, they would never receive the same level of care as what they do in the city. And that's one of the many reasons Rosie and I established MPG, and that I'm so passionate about teaching and sharing my Neuro Pilates knowledge, just to bring really high quality care to regional Victoria and all areas of Australia, so that it's not just the cities and the metro areas that get that level of care. And I guess the other hat I wear to ensure that happens is the APA Victorian Neuro Special Interest Group. And that primary focus there is just giving access to as many of our physio colleagues as we possibly can, the excellent PD opportunities that enable them to provide great care for our neuro folk out there too. To answer your other question about Bobath, so to become a neurophysio, we all do the same bachelor degree and come out with the same qualification. And as I did, many spend a couple of years dipping their toes in different areas and figuring out what's right for them. And then you can go do post-grad uni qualifications to become, I guess, a more certified neurophysio, but you can also do some really wonderful PD and courses from our amazing neuro colleagues and peers out there. And one really popular area in the neuro world is Bobath training, or the Bobath concept. It's also known as normal movement sometimes too, and that nicely explains what it is. It's a really hands-on and problem-solving approach in both the evaluation, so really getting your hands on to feel our patients, but also the treatment of individuals with neurological conditions that affect their movement and their tone, and functional impairments that have developed as a result of a lesion to the central nervous system. So with normal movement, it's striving to help someone with a neuro condition get their movement back to as close as normal as possible. But even in the weekend or the full training that you do with a bunch of 20 or so other physios, you'll see that what is normal movement? No one moves perfectly. Everyone has their unique bits and bobs that happen differently to normal, but I guess it's just striving for the most efficient and normal movement as we can in our patients.
Yeah, okay, interesting. And so with that in mind, for, I guess, specifically for our listeners who either may be a little bit new to movement education, or they don't do clinical work, or somebody who, wants to do clinical work, what is a neurological condition?
Yeah, great question. It's essentially any condition that affects the central nervous system, so the brain and the spinal cord, or the peripheral nervous system, which sends the information to and from the brain and spinal cord to the rest of your body. Most people don't know, but neurophysios also work really closely with the little vestibular systems, or balance types feedback systems in our inner ear that detect position and movement of our head in space. So in layman's terms, that really means we can help people with symptoms of vertigo and spinning, imbalance and disequilibrium. So, and those little systems talk quite closely to the brain, which is why we as neurophysios are well equipped to help with that too. With what a neuro condition is, there's the really common ones that lots of people would have heard of: Parkinson's, MS, stroke, but there's also some really weird and wonderful random neurological diagnosis, or even presentations that remain undiagnosed that we are able to treat and work with as well, just from our good understanding and knowledge of how the nervous system works.
Right. So would you say, as far as if I thought of neurological conditions, could be, like you say, could be vestibular, balance, do you tend to then work with an aging population, or not necessarily, or is that a little bit a wider scope than that?
No. Do you know what? It's actually a really common misconception. And I think Parkinson's is a great way to explain this. That's really commonly thought as a condition in our older population, but it's actually 20% of sufferers are under 50 years of age and 10% are under 40. And we hear more and more about early onset or young onset Parkinson's disease. MS, it's about a quarter as common as Parkinson's, but the most common age for diagnosis in MS is between 20 to 40 years of age. So definitely younger Australians. Stroke, up to a quarter of those are in people under 54 years of age. And cerebral palsy, another really common condition we work with, that happens to either babies or in utero, so that people are born with that condition. So I could go on, but I guess the common theme is that we see lots of neuro conditions in people our age and the younger population. It's definitely not just the aged or the elderly.
Mm-hmm. And so do you also work with like concussion and TBI as well, like traumatic brain injury? That would be part of that?
Yeah, hugely so. And concussion's a fascinating one at the moment that's really growing thanks to the media presence around that, which I think is a really good thing that people are starting to take that seriously. Concussion is a mild traumatic brain injury and it needs to be treated so. As neurophysios with our understanding of the brain, but also vestibular physios with the understanding of that balance system inside the ear, am I to be biased, but I think we do a pretty good job of treating concussion and working with people with concussion. Concussions can present very differently. There's kind of a few different subtypes of how people present, and neurophysios are really well skilled and have the knowledge to treat those different types, figure out which type of concussion someone has and then treat it accordingly. And traumatic brain injury and acquired brain injuries, yeah, definitely. Plenty of those that come through our door as well.
Yeah, sure. I certainly feel like we sometimes work with people with TBI and stroke and MS and all of the above as well. And definitely as a movement educator that doesn't have the foundational knowledge that you go into your field with, had found myself over the years, it's just a lot of, well, let's try this. Give me feedback. Okay, that worked or it didn't. Put it in my pocket. Let's try this. It's just a heck of a lot of playing around with that person in front of me and receiving feedback from that person. But the thing with neuro is it's never a linear pathway for them anyway. And then the next person that comes in and works with you, it could be having a completely different experience to the last person. So whatever you learned from the last person isn't necessarily applicable to the next people that you're going to work with, right? It's a complex scenario for every single person.
And you know what? Most neurophysios, not speaking on behalf of us all, but definitely the ones I know and work with, that's what we love about our job. There's no two people with MS that are the same. There are no two people with Parkinson's that are the same. No two people that have had a stroke that present the same. So we're constantly needing to assess and analyze and get creative and come up with completely different treatment plans and exercises for every single person that we see. So there's never a dull moment. We are constantly thinking and exploring new and different ways to do things.
Yeah, sure. And so if you're working with somebody with a neurological condition, I don't mind whether you chose one specific type of condition or whether you just want to pop everything under an umbrella and you're working them, how might the way that you work with somebody with a condition in a movement capacity be unique? And what are some considerations when working with neuro?
Yeah, I guess for Pilates practitioners, it's really well known that Pilates can help with strength and flexibility. So I guess let's start there. With strength, what we're probably thinking about is retraining target muscles and using Pilates as an opportunity to decrease overactive muscles or compensatory movements. So really hone in on exactly using our thorough assessment tools to hone in on what's weak and what actually needs activating in a really regressed way. And this can commence with quite assisted movement. So I guess blending that Bobath concept or approach that I mentioned before with Pilates, where you're getting hands-on, you're facilitating movement, you're using equipment and props to recruit really weak muscles. And then you can progress that towards resistance with gravity, bodyweight, bands, our friend the reformer, lightweights. All of that as they get stronger. So Neuro Pilates is a really excellent middle ground between the recruitment of really weak muscles through to full resistance training. It's also such a good choice for postural weakness. So many of our patients have trouble with core and pelvic and shoulder stability, and trunk function in itself is such a significant determinant and predictor of outcomes post having a neuro condition. People's ability to stand and walk and do a whole other range of things, and Pilates is such a great way to address that. When it comes to flexibility, a big thing that we're thinking about as neurophysios is tone, and whether a patient is low toned or whether they're high toned, whether they've got something called spasticity, which is, I guess, the next step on from increased tone in a muscle, and how we can use Pilates to address that. But then there's all the other weird and wonderful, I used that term before, things that come into play with the neuro patient. What's their motor control and coordination like? Do they have pain from not moving their joints through full range or from having tight muscles? Have they got bladder and bowel dysfunction? Is there visual changes or vertigo or dizziness from that vestibular system that I was talking about before? What's their sensation like? Have they got sensory changes or impaired sensation, proprioception? Do they know where their limbs and their body is in space? Is their breathing okay? Are they able to expand their rib cage and take a full breath in? Can they follow commands? Is their cognition fully intact, and are they able to dual task and do two things at once? I could go on and on, but I guess our strength is looking at the bigger picture and all of those things and trying to use our Neuro Pilates to address a bunch of those at the same time.
Just a quick little interruption to say a big thank you to listening to the Pilates Lounge podcast. This podcast is all about sharing our love of movement and Pilates with as many people as possible. So if you're enjoying the show, please take a moment to review us so that we can get the word out there. Also, if you haven't joined us on the Pilates Muse newsletter, it's a bi-weekly newsletter that shares a whole load of information with you. And we also have virtual online education programs. So if you're looking to get inspired and grow even more as a Pilates professional, check us out, www.thepilatesprofessional.com.au. Back to the show. And, well, I mean, it just sounds like you just do Pilates with them. You know, that's exactly what we do in Pilates. So anyone with a neuro condition needs Pilates.
And
but that's why you
I love it.
So much.
Yeah, that's right.
Yeah.
And I think it's even just the physios that I've worked in my career, people in a wheelchair and they think, oh, they can't do Pilates, or people with really impaired sensation or proprioception and think they can't do Pilates. But that is a barrier I really would like to break down, is you can really do Pilates. I do Pilates with a patient that I'm helping to teach their carer how to roll and sit up in bed, through to someone with MS who's training for a half marathon, and everyone in between. It really can be adapted. And you do need to get creative with the adaptations and the regressions, I guess, of the traditional Pilates repertoire for our patients, but it can be done, and it can be done really effectively too.
Yeah, absolutely. Absolutely. Well, you know, it's obviously, for our listeners, if you're looking at working with neurological conditions, or if it's something that fascinates you, this is where we are working one-on-one with the client, you know, and potentially one-on-one for a little while until we really get to know what their goals are, what our objectives are for them, you know, and that they have a good understanding of what they're capable of, and we have a good understanding. And then in our studio, we then move our neuro clients as much as we can into a small group of like up to 4 people, partly for the social side of things. You know, we want to create community of people wanting to come to their session. They get to know the people around them, and it really does become one of their outings for the week, or, you know, 2 of their outings for the week. And they're in a space where not only, I agree, the Pilates equipment does really support people if we use it with mindfulness and with curiosity as well, so that we can change anything on the machine to suit the body in front of us. It allows for people that might not necessarily feel completely capable in their everyday life, capable of doing things that they didn't even realize they were able to do, sometimes in a different position, but they can now lift their leg where they weren't able to lift their leg.
You're so right. And we're often thinking about neuroplasticity, and that's a whole nother conversation for another day when we go there. But essentially, there's 10 guiding principles for neuroplasticity in movement retraining. And one of them is just the beliefs and the self-efficacy and the love for it. And those groups you talked about, we've successfully just set one up here too. And one of the clients, excuse my language, I don't know if I can share on here, but she always says, I just bloody love it at the end of every session. And she comes every week and she will not miss it. And because she's had that behavioral change and that buy-in, and she's consistent with her practice, she's improved so much. And you talked before about goals. She's achieved all her goals and got all these additional unexpected ones that she wasn't anticipating from just really regular and consistent practice. And she looks forward to it every week. It's one of the highlights of her week.
Yeah, we see the same as well. Could we touch a little bit on proprioception? You talked about, using Pilates, so I guess you would use movement in general to improve proprioception. Could we talk a little bit about that in case some of our listeners don't really understand what it is?
Yeah, yep. Going back to my group, I immediately think of one of my stroke clients who attends the weekly Neuro Pilates class when you say proprioception. Every single week, without a doubt, when she gets down on the floor and thinks she's lying symmetrically with her hips and knees bent, and her stroke-affected foot is always a good few inches further forward from her body than her non-affected side, but they feel even to her. She thinks she's lying symmetrically and perfectly even. That's proprioception not working well. So what proprioception is, it's the ability to know where our body is in space without physically needing to look at it and see it. So it's sometimes referred to as our sixth sense, and I won't get into the neuroscience of it too deeply, but in a snapshot, it's the feedback from our sensory receptors located in our skin, joints, and muscles, and it's really essential for planning movements and learning new movement patterns and skills. In our population, but also you'd just as likely see this in a musculoskeletal patient who's fractured a knee or an ankle and, let's say, for example, kept in a cam boot and not able to move their ankle for 6 weeks. Really similar to what might happen to some of our clients where they've got hemiplegic arms or limbs and they can't move as they normally would. When their joints and their muscles aren't moving through their full range and amount of movement, that proprioceptive information isn't getting fed back to the brain as much as it normally would, and it just changes the perception of where the body is and what the body's doing. So Pilates is such an awesome way to overcome this by stretching out tight or spastic muscles, moving joints through range, giving access to muscle recruitment that we're not normally able to achieve, increasing sensory input into the skin, all of which will improve somatosensory and sensory motor function. There's lots of other little tricks that can help that too. Getting people on their feet with weight through their limbs, doing things like balance training, doing that on lots of different surfaces, wobble boards, foam, Duradisc. Joint matching tasks are really good, coordination exercises, sensory retraining, all of those things can help proprioception.
Right. So I guess it's partly fair to say that if somebody has poor proprioception, then potentially they also have poor balance, because so often people come to the studio and they say, oh, my balance is shocking. And then it's not necessarily that we need to be working on the balance per se, but it's teaching people where their body is in space. So when you've got your feet in straps, or when you've got your feet on the foot bar, you're using the machines for feedback, giving your proprioceptors. So your proprioceptors are in all of your joints, your ligaments, your tendons, and your muscle spindles, and they're giving information back to your brain, and then your brain in turn is taking that information for movement to happen. So I always say to my student teachers, when little old lady falls off of the pavement while she's crossing the road and breaks her hip, it's not that she doesn't have the strength, it's actually that her brain didn't necessarily know where her foot is in space. And if we can improve that understanding of where her foot is in space, then she would have been less likely to fall over in the first place. So I guess partly what we're doing is just improving that feedback mechanism from the body to the brain so that we do have better body awareness, right?
Yeah, totally. And I don't think proprioception can cop all the slack for balance impairments and falls and balance issues. Again, that requires a really thorough assessment of all the different systems that come into play with balance, but it definitely can be one of the reasons. And you're right, training and improving those things is going to put someone's balance systems and balance reactions in the best possible way to prevent falls.
And so why is it that somebody with a neurological condition ends up with poor proprioception? Like what is the relationship?
Yeah, well, I guess you touched on some of the feedback mechanisms you were talking about before, like the Golgi tendon organs and such. When the joints and the muscles aren't moving as they normally would, then that can have the normal sensory feedback isn't going back up to the CNS, but then there can also be issues in the CNS themselves with, I guess, interpreting that information when even if it does get there accurately. It really depends so much on exactly what the neurological condition is as to the reason behind why the proprioception is impaired.
Mm-hmm. Mm-hmm. So what are some of the most rewarding aspects of the work that you do? Like, it sounds so fascinating what you get to do every day. Like you say, you get to go to work and you love what you do and it's different all the time. What do you love most about it?
Oh, gosh. There is really no better feeling than supporting a client with a neuro condition to achieve a goal. And that can look so different for so many different people. I've touched on a few different examples today, but it can be from something, and I guess if I'm going to use Neuro Pilates as an example, it can be improving someone's sitting posture and endurance so that they can spend longer out of bed in their wheelchair with their family and their loved ones, through to I've just helped a Parkinson's client get back on a horse for the first time in 10 years. We started off with doing some work on a fit ball, like a big inflatable ball, and then we turned the reformer into a horse. We put the box on top, the straps were the reins, etc., and progressed that until we got ready to get on the horse, and seeing his face light up on the horse was so amazing. I've got a really ataxic brain injury client at the moment who just wanted to be able to walk indoors without needing to rely on a stick or a frame, and by increasing her core and lumbopelvic control, she's been able to achieve that. Stroke patient recently, increasing her shoulder stability and strength and range enabled her to swim a lap of the pool, which was a goal she'd been working on for nearly 3 years. And she told me that she was so excited when she got to the end of the pool that her goggles filled up with tears because she was so happy. And hearing stories like that and knowing you played part in that journey is pretty cool. I guess, being honest, working with progressive neuro clients isn't always sunshine and rainbows, and the reality of what we do is that at times the rewarding part is supporting carers or loved ones to assist in the progression of a disease. But this can also be really meaningful too if you're able to assist with slowing the progression using exercise, or assisting someone to progress with the therapy and supports and equipment that you know they need, and to enable them to do that as safely and comfortably as possible. It's just a different type of rewarding, I guess.
Yeah, sure. And I think that you said a couple of really important things then, like helping somebody with a neurological disease get back on a horse, is like a 10-year goal, and being able to help them do that. These people they're not always just looking to function day to day. Like, they also have really big things that they need to achieve in life, and to think that you can be part of that and even have an open conversation about that. That could be some of the scariest things for these people to want to say out loud just in case they can't do it.
Totally. And I say to my clients all the time, and so do all of our team here, that no goal is too big and small, and don't think something is crazy or ridiculous. Run it by us. We can break that goal down into smaller achievable tasks. It's a great way to direct our therapy, chip away at it, and maybe modify exactly what the goal looks like. We get to work on such wonderful things with our clients down here. Being by the beach, I've got a stroke patient at the moment who hasn't set foot on the sand since she had her stroke because that's too scary. So that is our goal for summer, is to get her back on the beach. There's so many different ways therapy can look. It's not coming in and doing 10 sets of 20 of the exercise A, B, and C. Like, we can make it really fun and interactive. And Pilates is a really good way to do that. I used the example of the reformer on the horse before, but so often as physios, we're kind of trained to think about things at the impairment level, the activity level, and the participation level. And it's a real misconception that Neuro Pilates just addresses things at the impairment level, but it's not the case. It can be used to break down those participation-based goals into smaller activities, work on those, nail those, and then get back to doing the things that people want to be doing.
Yeah, totally. So it sounds like one of the key initiatives when you work with somebody with a neuro condition is that you're helping them set goals, or like you're kind of sitting with them and figuring out what is it that you want to get out of this, and where are we going with it. That's I feel like that's such a freeing experience for both you and for the patients that you're working with. But can you tell us a little bit about, so what say if you're working with somebody with Parkinson's or MS, like a neurological disease that is, potentially going to be degenerative over time, what does it look like? Like how might the Pilates that you're practicing with them be different to what you're practicing with other people?
Yeah. I think that comes back to knowing and understanding the diagnosis and the pathophysiology of that really well, and the physical impairments you would expect to see, but also what movement strategies are available to us to overcome that. And let's go to Parkinson's as an example. So people with Parkinson's often have reduced trunk flexibility due to axial rigidity. They have, a lot of the time, they will have impaired sensory motor integration, bradykinesia, or like slow, small movements, which can often progress to freezing or the shuffling that most people know of in Parkinson's. Cognitive impairment, we've already talked about balance and that being a problem in a lot of the neuro patients. Poor posture. So already just saying, I'm sure all the listeners hearing me say some of those things would already have exercises come to mind from a Pilates perspective that could help a bunch of those things. I immediately think straight to thoracic rotation and spinal extension and overhead arm work to help with that stooping, getting people in prone and working on spinal mobility and thoracic extension there. Big flowing dramatic movements and power movements in the arm and legs to help overcome those slow and small amplitude movements. Using things like external beating or breathing to create a bit of a rhythm to enable the patients to move to a pattern, or circular patterns or even reciprocal movements can help with that. With Parkinson's, taking into account things like balancing and cognitive changes and dual tasking, and being really careful to pitch the exercises appropriately and not overload that client to make it too challenging, and make sure you are setting them up for success is really important. MS, some of the more typical things you would see there. I've got a few clients who come to mind straight away who have got so much tone or hypertonicity that we actually need to give a really good stretch out of the tight or spastic muscles before we even bother trying to recruit the antagonist or the weaker muscles to give them a chance to actually fire and activate. Fatigue. My MS clients, when I'm doing Neuro Pilates with them, they need to have lots of active rest break and stretching. It's a really common part of the MS diagnosis, as is heat sensitivity. So the girls aren't doing it over winter, but two of the girls that come to the Pilates class, they come in and they'll do pre-cooling with icy water, and one actually wears an ice scarf during the Pilates class to get the most out of her class and ensure she doesn't overheat. Central vestibular dysfunction, so that dizziness and vertigo I was talking about before, is really common. So I need to be quite thoughtful in my exercise choice with my MS patients and making sure that the size and speed of head and eye movement isn't too much too soon. I do deliberately add that in though, because it can be used as a habituation or like a gaze stability exercise as part of their Pilates program. So it's not that we avoid it, it's just that we really think about adding that in or not into the program. Similar to the Parkinson's crew, we need to be really careful with cognitive overload. I don't need to tell anyone who listening to this today, but Pilates, there's often can be lots of layers and elements to an exercise. Switch this on, hold that while you do that, now add that. And that can be too much. And you just need to really peel it back and keep the instructions simple, or think about the types of instructions you're providing. Can you put your hands on and make them tactile? Can they use mirrors and have some visual feedback rather than too much verbal input? Motor control and coordination is often challenging, so that beautiful, precise, flowing, coordinated movement we love to see in Pilates, we often need to work pretty hard for that in an MS population. And I talked about it way back at the start with the common things you see in a neuro patient, but pelvic floor work is never something I would skip with an MS patient. It's really important. There's often lots of issues around bladder regulation and continence and pelvic floor strength. So that's another one I'll always add in there.
Ah, fascinating. So there's some similarities, but a lot of differences, which makes your job very exciting, very changeable every day, I'm sure. And between the two, between Parkinson's and MS, I think you did say about numbers before, but do you see one more than the other? Like, is one more common than the other?
Yeah, Parkinson's is about 4 times more common than MS. But given the younger diagnosis of MS, we do see quite a bit of that as well. And especially, I don't want to say that older people can't do Pilates, but it's definitely a popular choice for the younger clients that come through the door. And what I love about, one of the many things I love about Neuro Pilates, it's a really friendly and approachable idea. Everyone's mum or sister or best friend or brother has tried Pilates, or everyone knows someone who's doing Pilates. So it just feels like a normal thing for a 20 or 40-year-old to be doing, and not necessarily like they're needing to come in for therapy and really neuro-specific intervention.
Yeah, for sure. Well, nowadays it's commonly known. It didn't used to be at all. It used to be like, what is it? Is that stretchy thing?
I feel like most people have at least heard of Pilates now, haven't they?
Yeah, absolutely. Yeah, or heard of reformer, which isn't necessarily Pilates, but that's for another show. And so, can you enlighten our listeners a little bit more? Like, let's stick with Parkinson's for now, because that is the more common one. Could you delve a little bit more into what is it and how is it diagnosed? Like, yeah, tell us more.
Do you know what? I went to a Parkinson's gala lunch only last Friday, must have been, and there was 3 or 4 guest speakers there who had only not too long ago been diagnosed, and 3 out of the 4 had said that their neurologist followed them into the treatment room, so chose to walk behind them rather than in front of them, and sat down and said, what's your why are you here to see me? And it had fed straight back, I just watched you walk, you've got Parkinson's disease. It is very much movement analysis is a huge part of the diagnosis. There's shuffly gait and stoop posture that I mentioned before, reduced arm swing. Once you get to know it, and as a neurophysio, you can no longer walk down the street without looking at, or through the supermarket without going, ooh, I reckon, or I think. What tends to happen after that, though, is they'll be tried on the Parkinson's medication, and essentially if that's effective and helps with movement quality and returning things to a bit more close to normal, it's generally pretty sure that that's a Parkinson's diagnosis. And yeah, I mentioned before that it's definitely that early onset and young onset Parkinson's disease that we're hearing more of, which is interesting. Amazingly, lots of research going into Parkinson's space. So hopefully sometime in my career, we know more about why that is and have better treatment options. And I guess the goal is a cure for Parkinson's disease.
Right, but we don't know at the moment, like what does somebody end up with Parkinson's? Like what went wrong on the track?
Yeah, no, it's mostly idiopathic or unknown. There's a few guesses as to why, but no confirmed reason. A few potential environmental predictors, but still trying to figure that out exactly.
Oh, wow, that must be so frustrating for people that are living with it, isn't it? That it's almost like, well, we kind of know where this might be coming from, but not really.
Yeah, and the why me.
Yeah, of course. Is it similar to MS? Like, does an MS diagnosis look like, and how does somebody end up with MS?
Again, it'd be with a neurologist. Actually, that's not true. But most people would notice the symptoms, head to their GP, and pretty quickly be sent across to a neurologist who then may recommend blood test. It's called a lumbar puncture, but where they take a small amount of the cerebrospinal fluid and check what's going on there, so analyze that. But the more common one with MS is to have a brain scan, so an MRI, and you'll see little lesions or plaques, and that's the primary way to diagnose MS and to monitor it ongoing as well. When you hear about relapses or progressions, it'll be, as well as experiencing the physical symptoms, it'll be also having a scan and seeing what the plaques and the lesions are doing and if there are more of those.
Mm.
So a bit easier to confirm, I guess, at a pathophysiology, well, from an imaging and a bloods perspective.
Mm-hmm. Mm-hmm. And so do you find, like, because there is that whole, especially when we work with MS, sometimes they'll come into the studio and they're quite capable of getting through the whole session, and then other times it's like 15 minutes and they're done, and then they still end up so tired after that short session. Like, sometimes it can be really difficult to judge. Yeah, I mean, like,
MS
people always
is
know
so
how they're
tricky.
feeling, but, it's a tricky one.
Yeah.
Hey, like, how do you deal with that?
It is so hard because they do not know what they're going to get when they wake up each day. They can have a fantastic day one day and feel cruddy as the next. And it's really so important to just teach them to listen to their body and to monitor their body and, I guess, take that into account with what they're doing. You're right, though. They can also feel really awesome in a session and overdo it. They might wake up, feel great, go to Pilates, go out and do X, Y, and Z, still feel great, keep going, and then pay for it for a week later because they've overdone it. So pacing is really, really important. Understanding what type of fatigue. So our exercise physiologist here actually is really learned a lot about this lately, but is it cognitive fatigue? Is it muscular fatigue? And as a result, how do you cater for that? For some of our MS clients, we've written exercise programs that are good day and bad day programs. So they have an exercise program that they wake up, I'm feeling great, I could do anything. That's where we do all the strength training, the aerobic training, get in all the high level stuff. And then crappy day programs where they wake up and they just feel rubbish and know that something is better than nothing and a small amount of movement is really good for their body. So that's when they might do their stretching or their joint mobility work or some gentle balance work. It's not that they avoid moving altogether, but they just adapt it depending on how they're feeling that day.
Right. So it's like you said before, it's like, quite often simplifying things for people. So, you don't have to be queuing every single thing that people need to be doing. It's, keeping things as simple as possible, that they feel like they're moving to the best of their ability, and also I feel like when I work with people with a lot of neurological conditions, both, traumatic brain injury, stroke, and MS, a lot of the work that we're doing in the Pilates studio is so good for their emotional health, but it's only good for their emotional health if we are taking their cues, that it can be really frustrating for them if they're not performing well, or if they're not understanding what it is that we're telling them, or, if they're not grasping a concept. So it's up to us to really use our observation skills to pick up on those cues that people might not necessarily be sharing with us, so that they do come in and feel a sense of achievement, but also a sense of support,
Yeah, that's right. And to gently encourage without pushing it too much, because the evidence does show that some exercise when people with MS are fatigued is actually good for them and they'll feel better after it. But we all know when you're feeling crappy, or you've just had a bad night's sleep, or you're tired for some other reason, it's the last thing you want to do. But generally, once you get out there and do it, you'll feel better for it. And that is exactly the same in MS. It's just understanding the types of fatigue with MS and listening to your patients and making sure that they're listening to their bodies too and adapting when you need to.
Mm-hmm. Tell us a little bit, what are some of your favourite resources? So, if I was interested in understanding neurological conditions better, specifically from a movement perspective, are there any resources, books, journals where I could learn more that you know of?
Oh gosh, bad news. There isn't a one-stop shop, unfortunately, that would have it all. My advice would be to just educate yourself and learn what you can about the condition and how it impacts someone physically. Neurophysios are mostly pretty great at keeping up to date with what we call evidence-based practice, of which the evidence for Neuro Pilates is really starting to emerge now, which is great. But that's not all there is to it either. You talked right at the start about clinical practice and becoming familiar with neuroconditions and seeing what works and what doesn't. And that's really important too, is the more neuro clients you see and that you're willing to have a go at Pilates with, the more you will learn from that around what works, what doesn't. There's some really great Neuro Pilates courses and podcasts and things out there for physios specifically. But as a Pilates lover, for the non-physios listening today, my biggest recommendation, and one thing I'm really passionate about, is just collaborating with the person's healthcare team and working with them to help treat the neuro side of what you're seeing. Understanding what one another do and the roles they play, and each allied health or movement practitioner's strength is so important. And as neurophysios, our goal is to keep clients doing what they love doing and keep them going to seeing their Pilates practitioner in the community for as long as possible. We never want to take that away from them. So about working together, we do that all the time in our business, where we'll go out to a patient's community yoga class or Pilates class or gym and observe them in their community setting that they love, identify the challenges and teach the person working with them a few neuro tips and tricks and strategies to help them get the most out of their program, and then just come back as needed, or when a tune-up's required, or when they've progressed and they're moving on to the next thing. And essentially, if we've done a good job, we won't need to come back for some time and they'll be right to continue on doing their Pilates. So that's something I'd love to see in the future, improved collaboration between, I think as an allied health team, we do it well, but between allied health, doctors, and all types of movement practitioners and specialists in the community is playing to each other's strengths and using each other to get the best possible outcome for our neuro clients.
Yeah, for all our clients, right? I mean, I feel, well, obviously neurophysio is quite unique. How many neurophysios are there in Australia? Is it a common practice?
Do you know what? I don't know the answer to that question, because exactly what a neurophysio is a hot topic at the moment. So there's different levels of credentialing you can get. And a lot of people will just say that they're a neurophysio if they're working with a neuro population and have done for X amount of years, versus you can actually become a titled neurological physio, which means you've actually met certain criteria and done a certain amount of training, or step above that, a specialized neurophysio. But there are loads of people out there who work with neuro patients. Some people solely. We were talking before about regional areas, and a lot of people in those areas, and gosh, Darwin is a fantastic example. They see so many different people with so many different conditions that they can't specialize in one thing. They need to be able to do it all to help all the people out there. So there's plenty of therapists out there too working with neuro patients who don't solely do that, but are the only person available to do so, so are doing their best job.
Yeah, sure.
Most bigger towns or areas would have a neurophysio, though.
Right.
I would guess.
Right. And I know that I know that you are very passionate about, utilizing Pilates in working with neuro. And so you produced and share specifically a workshop for physios on an introduction to Pilates for neurological clients. So for those of our listeners who are also physios, you need to be a registered physio to be able to do the course, but I'm pretty sure you can get PDP points for it as well, can't you?
Absolutely, you can. EPs can attend that course as well. Now, first up, I do need to provide a shout out to a very wonderful and clever colleague of mine, Jane Costello, who is actually the brains behind and wrote this course. And I've just been fortunate enough this year to jump in and commence teaching it alongside her. But she's been doing so for almost 10 years now and sharing all her wonderful skills and knowledge around Neuro Pilates and her other baby, adaptive recreation. But it's really about some of the things we've discussed today, I guess, about giving physiotherapists who work with a neuro population the confidence to use Pilates in their practice. A huge focus of the course is taking the traditional mat and reformer-based repertoire of exercises and providing a huge bunch of ideas for regressions to cater for those neurological impairments or really common things that we see that we mentioned before. So after coming to the 2-day course, participants should leave with a huge range of tips and tricks up their sleeve to be able to apply to their neuro patients to adapt the Pilates exercise to make them work for that population. Oh. It really is a great course for anyone that's got an interest in using Pilates but just not sure how to blend it with the neuro caseload.
Oh, that's awesome. So are there things that we can be doing, like, as instructors? I mean, I feel like we have touched on a lot of this, but, if somebody doesn't currently have a neuro condition, I mean, these are MS and Parkinson's, they're idiopathic, which means that we don't really know where they come from. So what types of things can we be doing to make sure that our clients have really healthy brain structure and, are really healthy in their function?
Yeah, the World Health Organization recommend for optimal health and well-being that we're strength training twice a week, right? So Pilates, big tick. If someone's doing their Pilates twice a week, they're ticking that box, which is awesome. Aerobic exercise is neuroprotective for all of us and is great for so many other reasons too. So if you can incorporate some huff and puff type work into your sessions, whether that's getting the jump boards out, increasing the sets and reps, or if it's a more movement control focus session, then encouraging people to do that outside of their Pilates practice is really important. Talking about some of those conditions we mentioned before, 80% of strokes are preventable. So it just generally comes with a healthier lifestyle, as you would see in those that show up for a Pilates class, that just optimizing your exercise and your health and well-being is going to put you in the best position possible to, fight off a neurological condition or to deal with it if you get it. And that's the other thing that's really evident in our profession is that people who do get diagnosed with a neuro condition, but who've come from a healthy lifestyle and background, they often do so much better because they've put their bodies in the best possible state to fight that condition. I've actually got a new client who's come to me for Pilates specifically. She's got a condition called spinocerebellar ataxia, and she was a bodybuilder before her diagnosis. So even with all the strength that she's lost, she's still so much stronger than I am. So we don't need to worry about addressing that in physio. And instead we can jump straight in and focus on her motor control and her coordination because she's already done all the hard work around the strength. So I think, movement and just having yourself as fit and as strong as possible to effectively get the most out of our bodies and live our best possible life is the best way to prevent or help recover from a neuro condition should you get one.
It's all such relevant information for our listeners. I really appreciate you spending time with me today, Zoe. And I think that the things that you talked about, it's going to be easy for our listeners to digest, regardless of their current understanding of neuro, and potentially open the doors for people, like I said at the start, I mean, I was like the only Pilates in Darwin for many years. So I was always throwing these really complex conditions, and every single client that came in the door was a huge learning curve. And it's okay to let our clients know that we don't necessarily know, but if they want to work with us, you can learn things with your clients along the way, especially if you can work with their allied carer as well, or any other therapist that they're working with. I agree with what you said, Zoe. It's really about us working in a team environment for our clients' best health so that they can really reach their goals. I think that's a really key message that is such an important conversation that we need to be having. Rather than put everybody into a box of expertise, let's come together as a community to do what's right for our clients.
Absolutely. And obviously, my passion is to be able to support neuro patients to be able to have access to Pilates, and the best way to do that is to work together.
Mm-hmm. Thanks again for joining us, Zoe. Hey guys, I'm going to be popping some notes in the show notes. So if you want to learn about Zoe's workshop that she's got on, if you are a physiotherapist, or if you just want to check out her physiotherapy in Geelong, she's got some great blogs on the website as well. I've already stalked her, already vetted her for you. I'm only joking. And thanks so much for joining me. My name's Katie Crane. I'm the Pilates professional. I'll be with you next week on Wednesday, as usual, for another episode of the Pilates Lounge podcast. Bye-bye.